Dear well-wishers and learned colleagues, uh, today is my third video on our knowledge channel of acupuncture, AcuKnowledge. I'm going to share yet another clinical pearl with you today. This is about a patient who was an old patient of mine and he was coming to me for chronic low backache, sciatica, cervical spondylopathy, and all those problems had gone very much better with acupuncture. He was now coming to me only once a week for a follow-up treatment. However, uh, in the beginning of this month, he told me that he had issues with sudden extreme weakness. He's about 74 years of age. Extreme weakness and breathlessness on walking. And as I checked his tongue and pulse and everything, I found there was nothing very majorly wrong, except that I realized that he showed signs of heart blood deficiency. And I recommended that he should consult a cardiologist at my hospital where I work, the Sir Gangaram Hospital. So a senior consultant there at Gangaram Hospital, he consulted him, and they, after doing his cardiac assessment, they decided that he needed to be doing a angiography. An angiography was done, and it revealed multiple blockages, over 90% in all the major arteries of the heart, and he was advised to get stenting done in all the blood vessels. Almost 4 stents had to be put, and he asked me for advice, and I said you should go ahead with it. But when his biochemistry tests were done before the surgery, his serum creatinine levels came up to 1.70, and the surgeons there decided that they cannot operate with that high, because he is a diabetic also, and with that high levels of creatinine, they recommended that he should bring down the creatinine levels to normal levels before they can plan his surgery. He came back to me, and we started treating him for the raised creatinine levels from June 11th, and we gave him daily acupuncture treatment sessions till the 24th of June. I used to give him both the front and the back group of acupuncture points, and the best part of the treatment has been that after every 5 days we used to repeat his creatinine levels, and they started gradually coming down. And as on 24th of June, his serum creatinine levels came down to 1, and this was quite acceptable to the surgeons at the hospital, and his surgery was finally done on the 27th of June, and it was successfully done, and he is now hale and hearty and on the way to recovery. I would like to share the treatment protocol which I followed for this patient, and I'm sure this will help a lot of practitioners of acupuncture globally as well as in India to be able to treat such conditions where creatinine levels are less than 2. I have found the results to be very, very good. So I will now be sharing the treatment protocol. Now I will be sharing with you the treatment protocol which we followed. So we gave the front and the back sessions back to back. Each treatment session was for 20 minutes, and the points which we used was, remember, the basic PNST, which I have already explained to you, which we do almost in all our patients, followed by needling at LI 18, stomach 11 on the neck, REN 17, REN 12, REN 9, REN 6, REN 4, stomach 28, and liver 14. On the hands, we used P7, lung 8, lung 5, LI 11, and LI 14, both sides. And on the legs, we use again bilaterally kidney 10, liver 8, spleen 9, GB 34, stomach 36, spleen 6, kidney 7, kidney 3, spleen 3, and liver 3. So these are the points which were used for treatment, and it was accompanied with moxibustion with roll moxa at REN 4 and kidney 7 bilaterally. for 5 minutes at each point. So 5, 10, 15 minutes. 5 minutes each point. In all 15 minutes of moxibustion, and needles were retained for 20 minutes and thereafter removed. Then we put the needles for the back. Pause kar dena. Next, I share the points which I use for the back treatment. UB10, DU12, SI10, UB15, UB18, 19, 20, UB23 and 52, DU4, UB27, UB28, UB32 and UB40. Again the needles were retained for 20 minutes and roll moxa was done at UB23, UB52 and DU4. So 5 points in all for roll moxa and 3 minutes at each acupuncture points. That's the treatment session, the treatment protocol we followed, and we really achieved something which was very difficult in clinical medicine, and as a result of this treatment, a non-invasive treatment and a very safe treatment, we were able to help this patient out who has been an old patient of ours, and he was able to successfully get treatment by the cardiologist done, and all his stents have been successfully placed. Thank you very much, and I am confident that a lot of the practitioners who practice acupuncture will be able to get help from this treatment protocol and use it to help their patients. And I must again, as I always tell at the end of my recording, that these treatment protocols are to be strictly followed only by qualified medical practitioners who practice acupuncture and not by the lay people. Thank you very much.